stress causes about 90% plus of all chronic disorders. For people who have pain out there, okay, they will know what I mean. When you get tension and stress, your sympathetic system is very much stimulated. So you got a lot of sympathetic hormone that constrict your vessel, make you tense, make your hand cold, your feet cold, okay? Right. But that's not balanced by the parasympathetic nervous system. So what had to clear all this toxin? The liver and the kidney. So for people with chronic disorders, the liver and kidney are weakened, very much weakened. The last thing you need is any more drugs. People with depression, okay? Depression causes you to throw a lot of toxic hormones. The liver and kidney are weakened. You don't need Prozac, you don't need Pamela, you don't need Xanax.
Makes it worse.
Makes it worse because you dump in more toxin for the liver and kidney to clear. I don't use that. Short-term medication can be very helpful. If it relaxes you and give you a good night of sleep, you recover a lot of energy.
If it changes your attitude. So
in the beginning, okay? But chronically taking it and with the concept that you will never stop it, you have no rationale at all. Even for high blood pressure, for asthma, for any chronic disease, no, not after my paper's out. Somebody's going to have to publish my paper. See, yeah.
Doctor, this is great, and we're running out of time, but, you know, like I said with Nina, if you want to find out more, you can call the number at the end, and I'm sure the doctor will be glad to explain it, but this is an exciting new...
Great information.
Yes, it really is, and
yes.
I think you're going to bring a lot of help to a lot of people, and I think that's important in this world.
Definitely.
And also just educating people on these shows and explaining to them that stress is what's causing it, and surgery and pharmacy is not curing it.
But look at the problem we're bringing up to the government. Health reforms. 80% of what we do today to our patients is not only not necessary, but make them sicker.
Makes it worse. Doctor, we're running out of time. It was really a pleasure to have you with us this evening. Thanks so much for coming on.
And just continue to imagine your fingertips coming all the way to your forehead. And this is your own mind bringing your fingertips in. I'm merely your guide today. So use the power of your mind and imagine them touching your forehead now.
It's very frightening. I went to a lot of doctors because...
How are you dealing with this now? I mean, how are you being treated for this now?
No, I had a lot of tests, and they said, you know, there's nothing wrong with your heart, and I thought, because I had a lot of drugs when he was born, maybe.
Big breath and blow it out. Another big breath, blow it out. Another big breath, blast it out.
Injection.
In other words, subjected to the tests that we're used to in Western medicine.
Scientific study. That's a tremendously provocative statement to make that you can cure this disorder.
Dr. Tong?
A very simple thing to do. If the patient takes so much drug before the treatment and do not have to take it forever later, that's better than any scientific experiment. Because if you get from a sickness that you take drugs for previously all the time, now you don't need to take it.
Is medication the principal way we have been treating this?
Let me say one thing first. Because someone responds to a treatment doesn't mean it was the precise treatment that did the thing. For example, in our studies in my office in Beverly Hills where we do free clinical trials, we give people some sugar pills. 1/3 of people with panic attacks will respond to a sugar pill with nothing in it. It's what they believe that does it.
The panic attacks, PMS, midlife crisis, and all of those all seem the same to me. They all start from here and they work down. Do you know, doctors, do you believe that they're all one and the same or the same symptoms?
Absolutely the same. The mind affects everything, okay? One word on medication. I said it during the intermission. With panic attack and chronic disorder, your liver and kidney are weakened because of all the stress hormone being produced. Any unnecessary drug is going to cause it worse.
Do you disagree with that, doctor?
I really am embarrassed by that. That's absolutely unreasonable. That's absolutely unreasonable. You can't go on national television and make a statement like that without any evidence. To say that all things are the same and the treatments are all the same puts us 500 years back in history. We stopped doing that centuries ago. That's absolutely incorrect.
Well, the fact that I'm trained in the same place, but I only care the good things. I look for other ways that will not harm the patient. There's a New England Journal study by Dr. Eisenberg. There are more people last few years that visit alternative doctors than family practitioners. That's because we're using too much drugs.
What's your, you know, the public is voting with its feet, and I hear what you're saying, obviously, but...
I think there's an anti-scientific movement in this country, and I think And I think that I think there are people who feel that, science has done terrible things, but we are where we are today in the good ways, with our medicines, with our fax machines and planes and air conditioners, because of scientific research. To throw that all out, to throw out the best of it is a mistake. I'm not saying there isn't a downside, but to throw it away is a mistake.
But you're covering the symptoms only. You have to take it forever. You find a way that you can stop it. What is so difficult about checking it out?
It's not something that happens every day. So you go a week or a week and a half or 2 weeks and you think, oh, I'm over it, and then you have one all of a sudden again.
Can we give everyone, maybe the people with the various treatments, a chance to advise you? What would you say? What would you recommend that she do? Stephanie?
I would probably do hypnotherapy.
Whatever works, but be careful, please. I agree with Dr. Munjak completely. I respect him. Be careful of the word cure. Let a red flag go up when you hear that, please.
Dr. Tong?
You change your mind after my paper's out.
You feel like you have something new and
Absolutely.
To contribute. Okay.
I hope you got my message. All chronic disorders are indeed curable. The fact is that the body has the power to heal all diseases. If there's one virus or bacteria that causes a disease that the body cannot heal, it will be the end of the human race. The ignorance of the medical profession of this fact and the lack of skill to heal the patients have projected very negatively on the patient. Imagine a patient going to a doctor, is told that his problem is incurable. There's nothing that he can do about it, and that he's going to just have to live with the pain and suffering for the rest of his life. Even if he felt that something could be done in the beginning, his mind could be convinced otherwise, and the healing process could be stopped. So, it is time that we talk about curing diseases. I have just submitted a detailed paper to the medical journal. My paper validates the ancient energy concept over the current chemical mechanistic model of disease. Our current model does not explain two very important characteristics of a human. That is intelligence and the ability to move by itself. I correctly identify the human being as two energy systems, the mind and the body, with the mind being the governing system that causes all the effects in the body. And so far, all we have been treating are the effects or the symptoms of the disease, where the functional causes in the mind are being ignored. This way, we'll never cure anything. More importantly, I have devised a treatment combining Western technology using the Eastern energy concept called neurobioenergetics. The treatment reverses the disease process to effect a cure. Because of the anesthetic injection, it produces very dramatic results, and it applies to a broad range of chronic ailments, from arthritis, low back pain, immune disorders, asthma, allergies, to mental diseases. Because it cures the disease, it can avoid over 90% of current use of diagnostic tests, drugs, and surgeries. If doctors practice this form of medicine, our healthcare crisis would be resolved. I have presented my finding last year in the annual conference of the American Academy of Pain Management. I have sent volumes of my materials, including videotapes and letters, hundreds of letters from my patients that are organized in different diseases, to the Office of Alternative Medicine in NIH. I have talked to health officers in California and attempted to talk to my congressman in Southern California. And so far, the response has been less than enthusiastic. I think this is understandable because my information would not be very popular with the powerful pharmaceutical industry, organized medicine, and lawmakers who are catering to the interests of these powerful groups.
Dr. Tong's East-West Wellness and Pain Center is located in Costa Mesa at Harbor and Adams. For more information, call 1-888-DR-TONG-1 or 714-556-8664. You can learn more about Dr. Tong's treatments by listening to patient interviews and viewing case histories on our website at www.drtong.com.